Green cleaners were designed really to address some of the environmental and the human health impact of the use of toxic chemicals that might have been a part of cleaners. And so it's an effort to really try to use less toxic chemicals in order to make the cleaning process safer, but it still is a cleaner as opposed to a disinfectant.
Cleaning and disinfection are very different processes. What's important is to first clean an item. The purpose is to remove surface grease, grime, soil, debris, body substances, and to remove as much as possible of those items. Following that is disinfection. And the purpose of disinfection is to inactivate or eliminate microorganisms, to get an item as clean and microorganism free as possible. What's really important is that cleaning must take place before a disinfectant is used, or it's very possible that the disinfectant will be partially or even fully inactivated.
It's really important to look at the environment that you're in. For instance, if you're in a home, you may be able to do more cleaning and less disinfecting, unless in that case there's an ill person in the home, where you'd want to make sure that because of the pathogens that may be present, that you'd want to make sure you do disinfection so that you also kill those pathogens. On the other hand, if you're in a school or a child care center, you really can't control what pathogens may come in the home. You really probably don't even know what pathogens may be there, whether it's on the toys, whether it's on the various products in the child care center, or in the recreation center, in the school. And so disinfection really becomes much more important as a routine part of the process of cleaning and disinfecting. And then there are healthcare institutions.
And really, in healthcare institutions, Chris, we really have to be careful about cleaning first and then disinfection. So in terms of green cleaners, many healthcare organizations are now looking at how they can use green cleaners where they're appropriate. For example, in administrative areas, possibly waiting rooms and so forth. But in areas where we know we have a very high bioburden of microorganisms, many of them quite pathogenic, disinfection following cleaning is really the key. For households, it's very easy to combine 1 tablespoon of a household chlorine bleach that's not scented and not splashless, and combine that with 1 gallon of water, and then you have an excellent disinfectant. So in thinking about green cleaning products and cleaning and disinfection, it seems to us that the person or the organization needs to assess what is needed in the particular environment.
And when it comes to the use of disinfectants, you always want to make sure that you follow the label instructions. That'll give you specific information on what kinds of pathogens will be killed and what kinds of pathogens it is not effective for.
When you use a disinfectant, it's important to let it dry. That is when it's doing its work. So you have to follow manufacturer's instructions about how long you have to keep an area moist in order to have the disinfectant be effective.